Rahel Zewude is going to take us through technology can lift the stroke burden of developing countries. Take it away, Rahel.
Okay. Thank you, Dr. Solis, for the introduction. So my name is Rahel, and the title of my presentation is Technology Can Lift the Stroke Burden of Developing Countries. So to start with, what is stroke? The World Health Organization, WHO, defines stroke as a neurological deficit of a cerebrovascular origin that persists for 24 hours, or that persists beyond 24 hours, or that is interrupted by death within 24 hours. Stroke is characterized by a sudden onset of different symptoms. So sudden onset of unilateral weakness, difficulty in speech and understanding, change in vision, severe headache, and loss of balance or dizziness are some of the symptoms of stroke. There are two main types of stroke. So the first one is ischemic stroke. Ischemic stroke is characterized by interruption of blood flow to a region of the brain. This is resulted by occlusion of blood vessels. And ischemic stroke contributes to 80% of stroke cases. The second main type of stroke is intracerebral hemorrhage stroke, or ICH. So ICH is characterized by bleeding in the brain due to rupture of blood vessels, and it contributes approximately to 20% of stroke cases. ICH stroke has a higher incidence in African and Asian populations as compared to Caucasian populations. And it is the second most common type of stroke, and it is the stroke type that is associated with the highest mortality rate. Its mortality rate can reach up to 97%, and hence ICH stroke contributes greatly to the stroke mortalities of the developing world. So every year, 15 million people worldwide suffer from stroke, and 1/3 of these patients die, 1/3 of them suffer from disabilities, and 1/3 recover with good outcomes. There are many risk factors associated with stroke. So some of them are hypertension, smoking, obesity, atrial fibrillation, diabetes, excess alcohol intake, family history, and physical inactivity. Some of the stroke risk factors are modifiable, while some of them are not. So stroke incidence in developing countries is increasing dramatically, and this could be attributed to different factors, but the two main ones might be, one, the dramatic increase of hypertension prevalence in developing countries. So it's pretty challenging to find the reliable data to see the prevalence of hypertension and stroke in developing countries. However, cross-sectional surveys indicate that up to 35% of adults in Asia are living with hypertension, and up to 33% of adults in Africa are living with hypertension. And second factor that contributes to the increasing number of stroke incidents can be that low and middle income countries are now home for 80% of the world's smoker population. Canada annually spends about $3.6 billion in stroke-related costs. So if a developed country such as Canada spends a significant portion of its budget on stroke every year, we can imagine that the impacts of stroke in developing countries are very much pronounced and very much significant. So stroke affects developing countries significantly because the current treatment, diagnosis, and prevention approaches are not cost effective. And in this paper, in this presentation, I would like to explore how technology can play a role in lifting that burden and assisting developing countries in stroke prevention, diagnosis, and treatment. So when we talk about stroke prevention, the major important modifiable stroke risk factor is hypertension. Uncontrolled hypertension contributes to 12.3 million stroke cases every year. Hypertension is the primary cause of 60% of ICH strokes and 50% of ischemic strokes. And WHO predicts that 1.25 billion adults worldwide will be living with hypertension by the year 2025. Lower blood pressure is strongly correlated with lower stroke risk. For each 10 millimeters of mercury reduction in systolic blood pressure, the stroke risk of a 60 to 79-year-old adult is reduced by 1/3. And therefore, the primary stroke prevention approach in Europe and North America is blood pressure management. So how do we measure blood pressure? So traditionally, individuals would go to hospitals, clinics, or any healthcare facilities and get their blood pressure checked with a sphygmomanometer. However, in developing countries, healthcare services are not affordable and they're very much limited. So routine health screening is hardly available. With routine blood pressure monitoring not being available, hypertension remains undetected and uncontrolled, and therefore it contributes greatly to the increasing incidence of strokes that might have otherwise been prevented. So if individuals can have their own blood pressure measuring devices, they can check their blood pressure closely and frequently so they can detect their hypertension and control it as soon as possible, preventing stroke. So one innovation is digital sphygmomanometry. So this is a device where individuals can just wear it on their wrist. They don't need to go to the clinic or the hospital, and they can measure their own blood pressure. It does not require any training to operate and does not require auscultation. However, this device is has a price range of from $20 to $130. Even though this price seems reasonable for the average Canadian, it is rather unaffordable for most citizens of developing countries. So just to give a brief definition of what a developing country would be like, the International Statistical Institute defines a developing country as a country whose gross national income per capita per year is less than or equal to $11,000. So this price can be up to 2 to 13% of the monthly income of an individual in a developing country. So it is debatable that someone in a developing country can buy this device for the sole use of blood pressure measurement and nothing else. So the Withings wireless blood pressure monitor is one innovation that combines mobile technology with blood pressure measurement. So Apple is selling this device for $120. So this device is FDA approved and it provides reliable measurement of blood pressure. However, definitely its price of $120 makes it unaffordable for developing countries and also unaffordable for a lot of developed country residents. So another innovation that is coming up is the instant blood pressure app. So this is an app developed by a small company of young entrepreneurs in California. Our lab developed this app in 2014, and the app cost is only $4.99. So people can download this app on their smartphones, and they can measure their own blood pressure quickly, and it takes about 50 seconds to measure systolic, diastolic blood pressures and heart rate. However, we'd also like to question if this app can be distributed in developing countries, and the answer is yes, because although healthcare services are limited in developing countries, mobile subscriptions are growing in astronomical rates. So in 2005, the number of mobile subscriptions per 100 inhabitants in developing countries was 22.9. However, in 2014, that number went up to 90.2. And the developing world currently constitutes of 78% of the world's mobile subscriptions. And in 2013, smartphones worldwide outsold non-smart or feature phones. And most developing countries are located in the regions of South America, Africa, Middle East, and Asia. And these regions contributed to 67% of the world's smartphone market share in 2013. And these regions are predicted to contribute to 73.3% of the smartphone market share by 2017. So it is predictable that this app can widely and effectively be distributed in the developing world. However, the app is not yet approved by the FDA, and it has provided inaccurate measurements for several customers. So this is an innovation that could bring a significant change in the lives of billions, and it can reduce stroke mortalities in developing countries as well as in developed countries if it is proven to be accurate. So more emphasis and more innovation is required to turn this into a reliable medical app and to distribute it widely. So far we've looked at technology and stroke prevention, and now we would look at technology and its role in stroke treatment. So time is the most critical aspect of stroke treatment. When a stroke patient has a treatment delay for a minute, he or she loses 1.9 million brain cells every minute and 13.8 billion brain synapses. And for every hour delay in stroke treatment, the number of neurons the patient loses is equivalent to the number of neurons the patient would have lost in 3.6 years of normal aging. So time is absolutely critical for stroke treatment. So when someone experiences stroke in Canada, or when someone is having a sudden onset of stroke, the emergency medical service, or EMS, is promptly called by the individuals or those in the vicinity. And the EMS team comprises of paramedics, and the EMS team goes to the location and immediately takes the patient to an emergency department of a hospital. Once the patient arrives at emergency, they get their brain imaging done with a CT scanner, and they're assessed using standardized scales such as the National Institute of Health Stroke Scale, NIHSS, by emergency physicians and stroke neurologists. And in underserved populations, such as rural populations where a primary stroke care facility or a tertiary care facility is not within immediate reach, Telestroke has a significant benefit, and therefore it's becoming a critical component of the Canadian stroke care, especially in Alberta and Ontario, where Telestroke is widely used in hyperacute stroke care. So what is Telestroke? Telestroke is a form of telemedicine through which a stroke neurologist can diagnose a patient over a web interface by communicating to the patient as well as the emergency physician via a video conference call. So Telestroke has several benefits. So it reduces healthcare costs, narrows stroke care disparities among populations, it improves functional outcomes of patients, expedites treatment for patients, and it increases the number of patients who will receive stroke treatment. So the only approved drug for ischemic stroke is the tissue clot buster drug called tissue plasminogen activator, or TPA, and the drug needs to be administered within 3 hours after stroke onset. But most stroke patients are not able to take this drug because they present after 3 hours after stroke onset, or because when they go to the healthcare facility, no neurologist or any expert to make that decision about TPA administration is available. However, with Telestroke, the neurologist from hundreds of miles away can make the decision about TPA administration and can relay that decision to the emergency physician who's at the vicinity of the patient, so that the patient can receive TPA. So Ontario, by employing this Telestroke strategy, has increased its TPA administration average up to 30%, while Canada's average stands at 8%. So in the words of Dr. Frank Silver, who's a medical director of Ontario's Telestroke program, Telestroke makes it possible for a neurologist to be at the patient's bedside, even when that patient is hundreds of miles away, and assists the local physician with determining the most effective therapy possible. So this is a great approach for helping patients hundreds of miles away, but I would like to suggest that we can expand this approach and use it not only for patients who are hundreds of miles away, but for patients who are thousands of miles away. So can Telestroke work for developing countries? And the answer is yes, there is a possibility, because currently over 40% of the world's population has internet access, and inevitably even small and rural hospitals in the developing countries are increasingly equipped with internet access. So there is a potential to take Telestroke and make it applicable to countries beyond North America. And there is a critical need for neurology experts in the developing world, as shown by the following statistics. So to pull a low middle income country, India, as an example, there's one neurologist for a population of 1 million. And the situation gets worse as we go into sub-Saharan Africa, where there is one neurologist for a population of 5 million. In Canada, however, there's one neurologist for a population of 40,000. So we can see there is a critical need for approaches such as Telestroke that can alleviate that can help us out with a scarcity for neurology experts. So finally, I would like to discuss the role of technology in stroke diagnosis. So when a patient arrives at the hospital, brain imaging is done, and a CT scan is mandatory to differentiate between stroke types. So before we make a treatment decision, we need to know what type of stroke the patient is having, because the only approved drug, TPA, the only approved drug for ischemic stroke, which is TPA, if it is administered to an ICH stroke patient, then the patient can have further hemorrhage. So it is absolutely critical to get the brain imaging done before we make treatment decisions. So CT scans, since their inventions in the 1970s, they've improved greatly to achieve higher resolutions and higher speeds. And neuroimaging has expanded to multiple modalities such as MRIs, fMRIs, PETs, and diffusion tensor imaging, or DTI. And these innovations have enabled clinicians and scientists to get cross-sectional 3D images and patterns of functional activity in the brain, and in the case of stroke, to map the localized bleed in the brain and see the size of hematoma in ICH strokes. So even though there is a rapid innovation in the neuroimaging world, the devices still remain restricted in the developed countries because of their exorbitant prices. The price of CT scanner ranges from $70,000 to $2.7 million, and this is not including installation and training costs. So one of the options that could offer us a better, more likely affordable option for a CT scanner is the innovation of portable CT scanners. So these are CT scanners that could be attached to ambulances, and they transmit CT scans wirelessly to hospitals. And these are being used in Cleveland Clinic in their mobile stroke units. So when these CT scanners transmit CT scans to hospitals, the neurologists at the hospital can get the brain scans and make TPA administration decisions also in conjunction with the mobile lab unit that is attached with the ambulance. So portable CT scanners, can we distribute them widely in the developing world? I think the answer here is debatable, because portable CT scanners right now cost around $200,000, and this technology is evolving. And however, it was devised early in 2000s, and it has come far from the first invention. However, it is still being innovated with a focus on enhancing hyperacute stroke care in countries like Germany and USA. And cost-effective CT scanners need to be developed soon, because innovations in treatment such as telestroke cannot proceed without a confirmed diagnosis. So even in telestroke, where we have two models, where in one model the spoke hospitals or small hospitals or healthcare facilities connect with a hub hospital that is equipped with a neurology expert. In that case, a hospital or healthcare facility, to become a spoke hospital, they need to be equipped with a CT scanner. And if you're trying to implement telestroke in the developing countries, the model will not work unless the spoke hospitals are able to get a CT scanner on their own, so that the patient's brain imaging can be done and can get transported to a hub hospital or to a consulting neurologist. So another new innovation in the CT scanner world is linear CT scanner. So this is an innovation that is being developed with the focus on finding a suitable portable CT scanner that can work for developing countries, rural areas, war zones, and areas affected by disaster. So this model uses data acquisition and image reconstruction, and it has two scanners, one that positions the patient vertically and one that positions the patient horizontally, and each of them costs $50,000 and $100,000 respectively, and the overall system costs are $150,000. So the team of researchers is specifically focused on reducing the cost of CT scans and making it available to a wider, to more of the developing world and different areas. So this is a very promising innovation. However, the research team have yet to conduct the trials with large animals, and they also plan to further innovate this technology and build a portable prototype. So in conclusion, stroke is a substantial healthcare burden for developed countries as well as developing countries, but its impacts are greatly pronounced in developing countries because the current prevention, diagnosis, and treatment approaches are associated with high costs. And innovative technologies such as blood pressure monitoring apps, Telestroke, and cost-effective portable CT scans can relieve this burden and can change the lives of billions all around the world. So the increasing global access to internet can be used to raise public awareness about the role of preventable risk factors in stroke, and therefore emphasis needs to be placed in technological approaches and strategies that can address the disparity in stroke care and help developing countries. And I would like to acknowledge Dr. Shauna Pandya, who was my mentor in putting together this presentation and paper. And I would also like to acknowledge my instructor, Dr. Kim Solis. And thank you for listening.
Good presentation. I'm a little bit skeptical, though. That blood pressure monitoring app, do you know how it works? What's the principle behind it?
Okay, absolutely. I was also skeptical when I first came across it because it seemed very different from what we've known and what we think how blood pressure should be measured. So what they do is, I couldn't get detailed information, I guess also partly because they want to protect their patent, but you don't need any cuffs or anything. You put your, so I'll just go to the slide over here. So there's no cuff, nothing required. And as you can see, the person over here, I think, holds the cell phone close to their heart or chest, I think. And they get the waveforms on their phone, on the app. And then there's a reading over there next to it. So I'm not exactly sure how the app would work, but I appreciated the potential that it offered. And I think there's also a reason why it was not really approved by the FDA, because it has been providing inaccurate measurements as opposed to the Apple's Withings wireless BP monitor, which has been approved by the FDA. So I looked at the company, and it was not really, I didn't really see a lot of medical experts as part of the company's team. It was more of young entrepreneurs who work in the tech field. So yeah, they didn't really provide.
I think it would be really worthwhile to have some sort of accessible, easy-to-use device that would allow a person to take their blood pressure at regular points throughout the day. Because even if you go to a doctor's office, you're not necessarily getting accurate representative readings. Like, blood pressure is all over the place. So the ideal thing to do would be to monitor it over a long period of time at regular intervals. And for something like this, I think it's a really cool concept, but it really does need to be precise, because small changes in blood pressure can mean a lot if you have data to suggest that it's breaking a long-term trend, right? I guess I'm skeptical about this because a stethoscope and a sphygmomanometer for taking blood pressure is a really cheap combo. I mean, here you could get a well-functioning combo for about $35. And it's a little bit tricky to do it on yourself, but you can certainly do it. I mean, that's how I do it at home, because I don't trust machines that take my blood pressure for some reason.
I think definitely, because even in a developing country right now, they hardly use any digital sphygmomanometers. They use the traditional sphygmomanometers with the auscultations and everything. However, almost you rarely see an individual who's not a nurse or a doctor or who doesn't work in the medical field owning a sphygmomanometer and knowing how to use it. So it's it's almost always people need to go to a hospital or a clinic to get their blood pressure checked. But whereas almost everyone has a mobile phone, and more people are acquiring smartphones. So there is a potential that this app can be distributed in that way, but I can see the concern with people diagnosing themselves over inaccurate blood pressure measurements, and there was going to be fluctuations between blood pressure measurements, even just depending on what time of the day they measure, depending on their mood and their physiological state at that instant. However, I would be optimistic and say it would at least give people an advantage on being alarmed and being alert so that they could actually go and see a doctor. Oh, my blood pressure is 200 or my blood pressure is at 160. So something is wrong, and they might go and see a doctor. And in that case, if it was just a physiological state or some variation in that, that's okay. However, if that patient is actually having having an undetected hypertension, then we can counsel them about their diet, and they can introduce changes into their health and lifestyle so that they can prevent stroke.
I was talking to a friend of mine not too long ago, and he had this really cool idea about how to differentiate between hemorrhagic and ischemic strokes.
Yeah.
It's sort of it would be sort of a rough technique, and I don't remember exactly what it's called, but I don't know if this will ring a bell for you, but there are ways to measure blood or tissue oxygenation. It's sort of analogous to a pulse oximeter, where you can put it on your finger and find out the oxygen saturation in your blood. Yeah. These little devices that are out there. The idea is that you could reasonably use this technology in a mobile setting, like in a rural setting in an ambulance, and you could put this sort of cap on an individual's head, and you would be able to differentiate between oxygenation levels associated with a hemorrhagic stroke or an ischemic stroke. Problem with that is that it only reads to about a depth of 3, maybe 4 inches max, so you wouldn't be able to distinguish between the two kinds of strokes if it's very deep.
Yes. Yeah, I think that's a very interesting innovation actually, because one of the main struggles in the stroke care is differentiating between the two stroke types, because the treatment for one is like the death drug for the other. So an innovation like that would be very helpful because CT scans cost a lot and they're not available everywhere, and they're needed so that we can differentiate the stroke type. So if we can have something like that, it would definitely alleviate a lot of the stroke-related costs, and more people could be treated sooner. However, I'm not sure if that is approved by the FDA because
it doesn't even exist yet. The technologies exist for other applications.
Okay,
but this isn't. This is just something that we were thinking about. Thinking we could apply this to strokes. It would cost about $500 for a basic setup to actually just throw this all together. Yeah. So. Yeah, I mean, it'd be really cool to get started with this sort of thing and hand it off to someone. I
think, but just the concern is, how much is it reliable, and especially because there are so many different types of ICH strokes, and one is deep ICH stroke versus lower ICH stroke. So if the hematoma or the localized bleed is really deep in the brain, will that cap be able to detect that localized bleed that is very deep within the brain? And I guess also in terms of intervention, sometimes if surgery is the preferred method of intervention, then the people need to see where actually that localized bleed or the blood clot is located so that they can take it out.
Well, the cool thing about measuring oxygenation is that it actually, up to a certain depth, it actually gives you a rough visual representation of what's going on. Because you're measuring oxygenation of the tissue all over the brain based on certain measurement points. So.
Yeah, that is absolutely, especially for ischemic stroke, because just by definition, ischemic stroke is lack of interruption of blood flow to a certain area. So you would have lack of oxygenation, and if you have a device like that, you could easily measure it. So it would be very interesting to see that developed and help people all over.
I have questions about the portable CT scanner. Has it already been used in the ambulance or something?
Sorry, is it used in?
Has already been used on an ambulance?
On
The
ambulance?
portable
Yes, yes.
CT scanner?
Yes, so I got it from Cleveland Clinic. I think it's Mayo Clinic in Cleveland, or they call it Cleveland Clinic. But they use this portable CT scanner in their mobile stroke unit. So they have a mobile stroke unit, which means it's an ambulance, and it is equipped with a mobile stroke lab, and it has this portable CT scanner that can be attached and detached to the ambulance. So when someone is experiencing stroke symptom, you call 911, that ambulance comes, and you get your brain imaging CT scan done within the ambulance, and you get your lab tests done, everything within the ambulance. So I think it's not only Cleveland, but this is also, this has been applied to in certain clinics in Germany, if I'm not mistaken, and they have an ambulance. They actually have an ambulance with a neurologist in it. So when you call 911, that stroke ambulance comes, and all of your treatment approaches take place within that ambulance. You get your brain scan done, and they do all of the standardized assessments using the NIHSS, GCS, and the neurologist makes the decision right then and there. So it's very efficient. However, I think one ambulance cost us about $1.3 million. So very much, that's why I say the technology seems to be more focused on just further improving that hyperacute care in developed countries, and not just focused on the 80% of the world's population at all. So.
Okay, thank you.
I just wanted to ask, out of curiosity, what made you choose strokes? If it was like research interest or something like that.
Why would I choose stroke?
Yeah. Besides, I know you talked about like the global scope of it, but I was just interested in what made you pursue that topic.
Okay, so why I chose stroke for this topic was, first, I worked at a stroke research lab since my first year at university. So this is an area that I've been working at, and I find very interesting. And so my work is with ICH stroke and then blood pressure. So I'm trying to see the relationship between the size of localized bleed in ICH stroke patients and their pre-hospital blood pressure. So as I read more stroke-related papers and journals, I began to notice that the stroke situation in developing countries is completely neglected, or almost completely neglected, and stroke has a very strong association with the incidence of stroke is strongly correlated with lower socioeconomic statuses. So even in developed countries such as Canada and USA, stroke is more frequently seen in people who live in lower socioeconomic statuses, and because of the health and lifestyle options, including obesity and not having a healthy diet, not having the opportunity to have physical exercises in their daily routines and whatnot. So I thought it would be an interesting topic to research about and investigate maybe better solutions, possibly. But it was quite a challenge to find articles for stroke in developing world and hypertension in developing world.
So I had a question, and it involves all of the new technologies you pointed out in your presentation were, of course, really awesome, cutting edge, groundbreaking stuff. But it seemed like most of the companies spearheading this technology were Western companies, and Western companies have to be held to this certain standard, right?
Yes.
And I feel like because of that, that might, be the reason also that could translate into the higher price tag of the products that they produce. And I was wondering, do you know of any companies within the developing countries that are not held to this really high standard? And because of that, I'm not saying that they should cut corners or anything like that, but simply because the standards are not so high there, they may not need to include everything with these products. And as a result of that, the price tag could be lower on those products if they were made locally with local products, local companies. And I was just wondering if you know any companies that are spearheading that within the country itself, not just Western companies that want to make products and import them to developing countries.
Okay, that is a really great point, and actually that was one of my concerns when I was trying to research for this topic, because most of the innovations you see are in the Western world by Western scientists for the Western world. And that's why the prices are very much unaffordable for developing countries. And the one company that I came across with was the last technology that I pointed out. I don't know if my slides are not being shown there, I don't know why, but it's the linear CT scanner. So that's a technology that is being developed by a team of researchers in China and a team of researchers in the States. So it's a collaboration effort. But however, that was the only technology that I came across with that started out saying this is a technology that is being developed so that we can have a low-cost mobile CT scanner suitable for clinics in rural areas in developing countries, war zones, and disaster-affected regions. So this is what you see when the research world is diverse and when you incorporate local communities and developing countries in the scientific world, because they start making things that can be applied to their world as well, and that are focused on the needs of the world they live in. So I think there might be other companies who have started out different technologies, but another challenge is those efforts don't really get published in big scientific journals. So as a student, when you're trying to search what innovations happen in the neuroimaging field or stroke treatment field, you always would come across publications from big universities in the Western world. So that might be that might limit my knowledge of the innovations out there, but definitely that would be an ideal world. People in developing countries will be able to make those innovations for their own and address their own need.
I have one comment. I think technology is cool and all, but I think all of this speaks to a larger underlying problem.
Yeah.
We have better stroke outcomes because we have money and the infrastructure. We have better treatments. We're developing things because we have money, access to technologies. It shows that in other places in the world, they don't have that sort of money and infrastructure. So it's really difficult to implement technologies because they can't necessarily support its use. Overall, I think it's really important that we realize that it's that economic inequality that creates a lot of these problems in the first place. And it's not going to be like some iPhone app that's really going to change the landscape of health. We need to change how people live. You know, what the determinants of health look like for a given group or region.
Yes, absolutely. And as you say, definitely that one app, you know, we can be optimistic and say, yes, it could change the lives of billions. But in reality, there are so many social determinants of health that play larger roles in whether it be in stroke, cancer, or any other health condition. So that is one of the challenges we are faced when we develop any medical technology, because even with CT scanners, quite a few hospitals in third world countries have obtained CT scanners, have paid $1.5 million and purchased a CT scanner. However, once the CT scanner gets transported there, they realize it requires like yearly maintenance costs, installation costs, and you have to have the expert to operate it, and you have to train someone to operate it. And after some while, some of the CT scanners are not even useful because they do not have the expert to operate them. So that's one of the challenges we're faced when we develop some innovation and send it out to third world and expect it to work, because we do not really know the needs of that community because we're not living in it. And that's why we need to empower the people so that they can devise their own solutions rather than us going there and saving them. So
even things like this, this mobile clinic to come out of Cleveland or the stuff that they have going on in Germany, for the cost of this mobile unit, it seems almost ridiculous to spend that sort of money on this one unit that can't possibly service all of the people that could be having a stroke in one day, right? You could spend all of this money on a CT scanner, but if 1 million people have a stroke and you only have one CT scanner, or you only have one guy on your Telestroke conference able to, I guess, assess all of these stroke patients, like that would be a long day of doing the same thing over and over again. Somebody has to pay for that service, and I don't think that one person could even keep up with it. So I think we really do need to focus on just improving people's health overall instead of focusing on individual problems, because it just doesn't seem like there's a return on investment there.
Absolutely. I think every individual can contribute to, you know, what we see in the world and the problems of, like, the global burden of just this socioeconomic inequality. And all of us can carry a different burden, because some people are social activists, some people are working with children or elderly or maternal health. So I think we all can take different pieces of the pie and try to solve it on our own, so that we can finally come together and make a better world. Because I think if we neglect if we neglect small portions of it and just start tackling the bigger picture, I'm not sure if we could succeed immediately, and then meanwhile, millions and millions of people worldwide will be suffering and will be losing their lives, because we're more focused on the bigger picture and not seeing the individuals that are losing lives in the meantime, I guess. But yeah, I definitely understand that point of view, and that's something I always kind of battle with, which one should come first, whether should we change the system or should we go and try to solve the small things about the system so we can get there one step at a time.
The effort to get people in medicine to focus on humanitarian aims, I think, surprisingly, is probably facilitated by, there are a number of specialties now that no young trainees in the Western world are, you know, going into those specialties. They're, you know, avoiding them. Like in kidney medicine now, all the trainees are basically from, you know, developing world countries. There aren't any people who trained in the US and Canada who are going into those areas. So you can argue that they need a new approach to interest young people, to make them sexy again, right? To make those areas sexy again. And I think the idea of developing country approaches and also, you know, stem cell generation of organs, all the things that we talk about in this course have the potential to awaken the best and the brightest young people's interests in the areas of medicine that they're just not going into at all now. And I think that'll probably be a factor that will make people interested in this talk that you've, you know, given today. Stuff like that. We don't have to just give up. That it's kind of fun to think about, okay, well, you have these areas of medicine that have traditionally been huge, and suddenly no young people from the Western world are going into those areas at all. So something has to change, and you can imagine that the change could be quite positive. It could be innovative. It could be good for the rest of the world.
Yes, absolutely. Yeah. And yeah, I think even just in putting this presentation together, I came across different articles, and every time there was an article that touched upon the situation of, let's say, neurology in Asia or neurology in Africa, one of the authors was an African or an Asian, someone from that region. So I think we need to work more on our empathy skills, because so that we can empathize different regions of the world, and even though so rather than focusing all of our energy and just improving what we have, so in the case of the mobile stroke unit, where one ambulance costed over $1 million, that is that kind of shows our focus on, and how it has narrowed down to our specific location, and how we can improve things in that location rather than the bigger picture.
Right.
So if the medicine world and if the science world is more rewarding for scientists and clinicians who devise approaches for the bigger world and for a broader scale of populations, then it would be nice.
But medicine was never meant to be simplistic. It was meant to be heterogeneous with different facets. Like, you can always argue, you take any expensive technology, put the same amount of money into vaccines and sanitary water supply in any developing country, and you can save way more lives, always. But does that mean that you should do nothing but sanitary water and vaccines? No, obviously not. So there needs to be a
balance.
mix. So I think both of you today have talked about things where the cost seems quite high, but it doesn't mean that we should just give up on those areas and just focus on the areas where for $1 per person you can make a tremendous difference. Okay, well, it's been a good day of student presentations. Thank you both very
Thank you.
much.